I'm Dr. Alexander Jankov. I'm a hematologist and medical oncologist. I treat patients with various malignancies and cancers. I do specialize with a focus in breast cancer and gastrointestinal malignancies. What is neutropenia? Neutropenia is a medical term for a low white blood cell count, as a matter of fact, for low neutrophils. That is a type of the white blood cell count that defends us against infection. It's a first line of defense, and anybody who had any pussy infection knows what that would be. Now, when you receive the chemotherapy, unfortunately, as a collateral damage, your neutrophil white blood cell count will go down. And if it goes down too low, that is known as neutropenia. Unfortunately, there are risks associated with this condition, and that is that at that time, patients may develop a fever, and condition is then known as neutropenic fever. This condition is a relatively serious situation and needs to be addressed immediately by patients being seen by the doctor, obtaining the blood cultures, chest x-ray, urine cultures, and starting antibiotics. And most often, patients would need hospitalization and treatment with intravenous antibiotics. Neutropenia, however, is relatively easy to prevent, and certain chemotherapies we know in advance that will be causing neutropenia, and therefore we give the growth factor shots the day after the chemotherapy takes place. The growth factor shots are medications that actually stimulate the bone marrow to make more of the neutrophils, and will then raise the white blood cell count and will that way prevent neutropenia. Now, by this time, you're probably wondering, am I at risk for neutropenia? Even though you may be a cancer patient with the same cancer diagnosis as the next person, your risk of developing neutropenia may differ even with the same chemotherapy. Patients who are elderly, older than 70, with certain comorbidities, or as doctors know this as other diseases like diabetes, or kidney problems, or emphysema, would be at high risk for neutropenia. We do have an algorithm, cancer doctors do, and we follow this algorithm in order to help us to gauge who would be at risk for neutropenia right at the beginning of the chemotherapy cycle. So sometimes we would give the growth factor shot immediately after the first cycle of chemotherapy, as we predicted that a patient would be at high risk for developing neutropenia to start with. In other patients, you would wait until neutropenia actually develops and then treat with growth factor shots every single time, every time after the next cycle of chemotherapy. The frequent question is that we receive, how would I know if I had infection? Usually your body would tell you in a certain ways that you're not well and that you're suffering from infection. Contrary to many opinions, when you're having a fever, you're actually going to feel cold, chilly. Frequently, family members would notice that you're needing an extra blanket, or you're trying to dress warmly, or you're complaining that the room is too cold. That's a good moment to check your temperature. Other signs of infection would be cough, especially if you're coughing up sputum or phlegm that is yellow or green, frequent urination of the small amount of urine, loose bowel movements, also known as diarrhea, or just a malaise and fatigue and progressive lassitude. Neutropenia can be effectively treated, of course. However, the most important thing is to detect it in time. That is why in our practice we bring the patients back 1 week after each chemotherapy cycle for what we call nadir CBC, or nadir is also actually a term that implies the lowest point of the white blood cell count in the cycle of chemotherapy. If at that time your nadir CBC is low, implying that you have neutropenia, growth factor shots will be given to you, and this will effectively treat neutropenia. The nadir CBC is best checked 7 to 10 days later after each cycle of chemotherapy.